Welcome! Today, we're diving into hypothyroidism, a condition where the thyroid gland doesn't produce enough hormones. This small, butterfly-shaped gland in your neck plays a huge role in regulating your body's metabolism. When it slows down, so does everything else. Hypothyroidism is more common than you might think, especially among women and older adults. Recognizing its symptoms early can make a big difference in managing your health. In this video, we'll walk through the most common signs and symptoms, helping you understand what to look out for and why these changes happen. Let's start with the basics. What exactly is the thyroid? The thyroid is a small gland located at the base of your neck, just below the Adam's apple. It produces hormones that control how your body uses energy, affecting nearly every organ. When the thyroid is underactive, as in hypothyroidism, your metabolism slows down. This slowdown can lead to a wide range of symptoms, some of which might be subtle at first. Understanding the thyroid's role is key to recognizing why these symptoms develop. One of the most common and often first noticed symptoms of hypothyroidism is persistent fatigue. People with an underactive thyroid often feel unusually tired, even after a full night's sleep. This tiredness can be overwhelming and may interfere with daily activities, making it hard to concentrate or stay motivated. The reason? With a slower metabolism, your body isn't producing or using energy as efficiently as it should. If you find yourself constantly exhausted for no clear reason, it could be a sign of hypothyroidism. Another classic symptom is unexplained weight gain. Even if you haven't changed your eating habits or activity level, you might notice the scale creeping up. This happens because a slower metabolism burns fewer calories, leading to gradual weight gain. The weight gain is usually mild to moderate, but it can be frustrating, especially if you're trying to maintain a healthy lifestyle. If you're gaining weight without a clear reason, it's worth considering your thyroid health. Do you often feel cold, even when others are comfortable? Increased sensitivity to cold is a common symptom of hypothyroidism. Since your metabolism is slower, your body generates less heat, making you feel chilly more easily. You might find yourself reaching for extra layers or blankets, or noticing cold hands and feet. This symptom can be subtle at first, but over time, it becomes more noticeable as your thyroid function declines. Hypothyroidism can also affect your skin and hair. Many people notice their skin becoming dry, rough, or pale. Hair may become brittle, coarse, or fall out more than usual. These changes happen because thyroid hormones help regulate the growth and health of skin and hair cells. When hormone levels drop, these tissues don't renew as quickly, leading to dryness and hair thinning. If you're experiencing these changes, it could be linked to your thyroid. Digestive issues, especially constipation, are another frequent symptom. With a slower metabolism, your digestive tract also slows down, making it harder for food to move through your system. This can lead to infrequent or difficult bowel movements, bloating, and discomfort. If constipation is a new or persistent problem for you, and especially if it's accompanied by other symptoms on this list, it's worth discussing with your doctor. Muscle weakness, aches, and stiffness are also common in hypothyroidism. You might notice that your arms and legs feel heavy, or that you tire more quickly during physical activity. Some people experience joint pain or swelling as well. These symptoms occur because low thyroid hormone levels can affect muscle and joint function, leading to discomfort and reduced strength. Hypothyroidism doesn't just affect your body, it can impact your mind as well. Many people with an underactive thyroid experience depression, low mood, or increased irritability. You might feel down, lose interest in activities you once enjoyed, or have trouble concentrating. These emotional changes are linked to the way thyroid hormones influence brain chemistry and function. If you notice persistent mood changes, it's important to consider your thyroid health. Another subtle but significant symptom is memory problems or brain fog. People with hypothyroidism often report difficulty remembering things, trouble focusing, or feeling mentally sluggish. This can affect work, school, or daily life. The brain relies on thyroid hormones for optimal function, so when levels are low, cognitive processes slow down. If you're experiencing forgetfulness or mental cloudiness, your thyroid could be a factor. For women, hypothyroidism can cause changes in menstrual cycles. Periods may become heavier, longer, or more frequent than usual. Some women experience irregular cycles or even missed periods. These changes happen because thyroid hormones interact with reproductive hormones, affecting the menstrual cycle. If you notice significant changes in your periods, especially alongside other symptoms, it's a good idea to get your thyroid checked. A slower than normal heart rate, known as bradycardia, can also be a sign of hypothyroidism. You might notice your pulse feels slower, or you may feel faint or dizzy at times. The thyroid hormones help regulate heart function, so when they're low, your heart rate can drop. This symptom is often more noticeable in severe or long-standing cases of hypothyroidism. Some people with hypothyroidism notice changes in their voice, such as hoarseness or a deeper tone. This happens because the thyroid gland sits close to the vocal cords, and when it becomes enlarged or inflamed, it can affect your voice. If you notice persistent hoarseness or other voice changes, especially with other symptoms, it's worth mentioning to your healthcare provider. A puffy face or swelling, especially around the eyes, is another symptom to watch for. This swelling, called myxedema, occurs because low thyroid hormone levels can cause changes in the skin and tissues. You might notice your face looks rounder or puffier than usual, or that your eyelids are swollen. This symptom can develop gradually and may be more noticeable in the morning. Thinning of the outer edges of the eyebrows is a lesser known but classic sign of hypothyroidism. This happens because hair growth slows down when thyroid hormone levels are low. If you notice your eyebrows becoming sparse, especially at the ends, it could be related to your thyroid health. Sometimes, the thyroid gland itself becomes enlarged, a condition known as a goiter. You might notice a swelling at the base of your neck or feel a lump when swallowing. Goiters can be painless but may cause discomfort or difficulty swallowing in some cases. An enlarged thyroid is a clear sign that something isn't right and should be evaluated by a healthcare professional. Hypothyroidism can also lead to elevated cholesterol levels. Thyroid hormones help regulate how your body processes fats, so when levels are low, cholesterol can build up in the blood. High cholesterol increases the risk of heart disease, making it important to monitor your thyroid if you have unexplained changes in your cholesterol levels. Some people with hypothyroidism develop carpal tunnel syndrome, which causes tingling, numbness, or pain in the hands and wrists. This happens because swelling in the tissues can compress nerves. If you notice these symptoms, especially if they're new or worsening, it's worth considering your thyroid health as a possible cause. A decrease in sweating is another symptom that can occur with hypothyroidism. Since your metabolism is slower, your body produces less heat and, as a result, you may sweat less than usual. This can lead to dry skin and a feeling of being overheated less often, even during physical activity. Hypothyroidism can affect fertility in both women and men. In women, it can disrupt ovulation and menstrual cycles, making it harder to conceive. In men, it can lower sperm count and affect sexual function. If you're having trouble getting pregnant or notice changes in reproductive health, thyroid function could be a contributing factor. Although less common, some people with hypothyroidism experience hearing loss. This may be due to changes in the nerves or tissues of the ear. If you notice new or worsening hearing problems, especially with other symptoms, it's worth discussing with your doctor. Some people with hypothyroidism develop slow or slurred speech. This can be due to swelling of the tongue or changes in the muscles involved in speaking. If you or others notice changes in the way you talk, it could be a sign of thyroid dysfunction. Interestingly, many people with hypothyroidism experience a decreased appetite. Despite eating less, weight gain can still occur due to the slowed metabolism. If you notice you're eating less but still gaining weight, this could be a clue pointing toward an underactive thyroid. Sleep problems, such as difficulty falling asleep or staying asleep, can also be linked to hypothyroidism. Some people feel excessively sleepy during the day, while others have trouble getting restful sleep at night. These disturbances can worsen fatigue and impact overall quality of life. A consistently low body temperature is another sign of hypothyroidism. Since your metabolism is slower, your body produces less heat, leading to a lower than normal temperature. You might notice you feel cold more often, or that your temperature is below average when measured. Slowed reflexes are another neurological symptom of hypothyroidism. You might notice delayed reactions, or that your movements feel sluggish. This happens because low thyroid hormone levels can affect nerve function and muscle response times. Hypothyroidism can sometimes cause anemia, a condition where you don't have enough healthy red blood cells. This can lead to fatigue, weakness, and pale skin. The connection comes from the thyroid's role in supporting red blood cell production. If you're diagnosed with anemia and have other symptoms of hypothyroidism, your doctor may check your thyroid function. Swelling in the legs, ankles, or feet can also occur with hypothyroidism. This swelling, known as edema, happens because low thyroid hormone levels can affect fluid balance in the body. If you notice persistent swelling, especially with other symptoms, it's important to seek medical advice. A decrease in sexual desire or libido is another symptom that can be linked to hypothyroidism. Hormonal changes can affect mood, energy, and reproductive health, all of which play a role in sexual function. If you notice a persistent drop in interest, it could be related to your thyroid. Brittle or splitting nails are another sign of hypothyroidism. Thyroid hormones help keep nails strong and healthy, so when levels are low, nails may become weak, break easily, or develop ridges. If you notice changes in your nails along with other symptoms, it's worth mentioning to your doctor. In children, hypothyroidism can cause delayed growth and development. Kids may grow more slowly than their peers, have delayed puberty, or experience learning difficulties. Early diagnosis and treatment are crucial to support healthy development. Women with hypothyroidism may experience more severe menstrual cramps. This is due to hormonal imbalances affecting the uterus and menstrual cycle. If your cramps have become worse or more frequent, it could be related to thyroid function. Dry, irritated eyes can also be a symptom of hypothyroidism. The condition can affect hair production, leading to discomfort, redness, or a gritty feeling in the eyes. If you notice persistent eye dryness, it's worth considering your thyroid health. People with hypothyroidism may be more prone to infections, such as colds or respiratory illnesses. This is because thyroid hormones play a role in supporting the immune system. If you find yourself getting sick more often, it could be a sign that your thyroid isn't functioning properly. Some people with hypothyroidism notice changes in their breathing, such as hoarseness or a raspy sound. This can be due to swelling in the throat or changes in the vocal cords. If you notice persistent changes in your breathing, it's important to get checked. Wounds or cuts may take longer to heal if you have hypothyroidism. This is because thyroid hormones are involved in tissue repair and regeneration. If you notice that your skin heals slowly or you're prone to infections, it could be related to low thyroid function. Low blood pressure can also be a symptom of hypothyroidism. You might feel dizzy, lightheaded, or faint, especially when standing up quickly. Thyroid hormones help regulate blood pressure, so low levels can cause it to drop. Some people with hypothyroidism develop thickened or rough skin, especially on the elbows, knees, or shins. This happens because low thyroid hormone levels can affect the way skin cells grow and renew. If you notice changes in your skin's texture, it could be related to your thyroid. Loss of eyelashes, especially on the outer edges, can also be a symptom of hypothyroidism. This is due to slowed hair growth and renewal. If you notice thinning or loss of eyelashes, it's worth considering your thyroid health. Fluid retention, or edema, can cause swelling in various parts of the body, including the hands, feet, and face. This happens because low thyroid hormone levels affect the body's ability to regulate fluids. If you notice persistent puffiness or swelling, it could be a sign of hypothyroidism. A hoarse or persistent cough can sometimes be linked to hypothyroidism, especially if the thyroid gland is enlarged. Swelling in the neck can irritate the throat and vocal cords, leading to coughing. If you have a chronic cough with other symptoms, it's worth checking your thyroid. People with hypothyroidism may become more sensitive to certain medications, especially sedatives or painkillers. This is because a slower metabolism affects how drugs are processed in the body. If you notice unusual reactions to medications, it's important to mention your thyroid status to your doctor. Cracked or dry heels are another skin-related symptom of hypothyroidism. The skin on the feet may become thick, dry, and prone to splitting. If you notice persistent problems with your feet, it could be related to low thyroid hormone levels. People with hypothyroidism may notice it takes longer to recover from illnesses or infections. This is because thyroid hormones are important for immune function and tissue repair. If you're slow to bounce back after being sick, it's worth considering your thyroid health. To sum up, hypothyroidism can cause a wide range of symptoms, from fatigue and weight gain to changes in skin, hair, mood, and more. Many of these symptoms are subtle and can be mistaken for other conditions. If you recognize several of these signs in yourself or a loved one, it's important to talk to a healthcare provider. Early diagnosis and treatment can help manage symptoms and improve quality of life. Remember, your health is worth paying attention to, and understanding these symptoms is the first step toward feeling better.